Medicare is a federal health program for people age 65 or older and younger people with certain disabilities. We are approaching the annual enrollment period beginning October 15th. But if you're already being contacted by someone claiming to be with Medicare, it is a scam. Joining me is Kathy Rickardson with Quill Insurance Consultants. Kathy, you are a licensed insurance agent. Tell us, what Medicare scams are you hearing about that you just want people to be aware of, right?
Right. One of the things is that our clients, including myself, have been getting calls that say they're from a Medicare agency and they're calling to verify if you've gotten a new Medicare card. Medicare does not send you new cards every year. The Center for Medicare and Medicaid Services very seldom calls the client. It's like the IRS, they send you letters. It is unlawful to go door to door and tell people you're just in the neighborhood and you'd like to talk to them about their Medicare policies. That is not true. They're going off of a list that they've received because they have a list that people turning 65 or older. That's how they know who you are.
There's so many scams out there these
There
days.
is.
You have to be so vigilant. So if someone thinks they're been scammed or they've been approached, what should they do?
Good question. The first thing they need to do is every insurance company has their own compliance officer. Medicare has their own compliance officer. So you can actually go on to Medicare.gov, file a complaint. You need to keep the information as to the name of the person, what they called, a phone number if you have it, and their name. The more information we have to report, the better the compliance departments can follow up. We want to get the bad guys off the street and make sure that it's fair for everyone.
Open enrollment we talked about is coming up October 15th. So what should people know with open enrollment approaching?
Okay. Lots of new changes with the Inflation Reduction Act. So people should be aware that your drug plans are going to change dramatically. The out-of-pocket costs are going from $8,000 to $2,000. So check with your agent. If you don't have an agent, you can go online. You can put in your drugs on Medicare.gov, not Medicare.com.
Right.
There's a big difference.
Yes.
And they will come up and it will tell you which plans that are best for you and your situation. But until October 1st, us crazy agents cannot call you. You can call us if you receive your annual notice of change. But until October 1st, we can talk to you then about the new plans. We're still getting information on them. And then October 15th, we can actually work with you and change your plans currently from what you have. And maybe you're just fine staying who you are.
Great advice. Kathy Rickardson, thank you so much for taking the time to speak with me.
You're welcome.